The starting point of the TRIBE-2 study was the first TRIBE study that was conducted by the GONO group, where metastatic colorectal cancer patients previously untreated for the metastatic disease were randomized to receive FOLFOXIRI-Bev or FOLFIRI-Bev as upfront option. The study met its primary endpoint, demonstrating a better response rate, PFS and OS with the triplet. However, some concerns still exist in the scientific community with regard to the adoption of this upfront regimen, that is a more intensified regimen than conventional doublets. And these concerns include the feasibility and efficacy of treatments after progression, as well as the actual superiority of administering the 3 cytotoxics upfront instead of in a pre-planned sequential strategy of first and second line. So, in the meanwhile, some important achievements were reported with regard to the efficacy of the inhibition of angiogenesis in colorectal cancer, the role of maintenance, and the efficacy of anti-angiogenics beyond progression. Drawing from these considerations, we designed the TRIBE-2 study. That is a strategy trial, always from the GONO group, by the GONO group in Italy, where untreated metastatic colorectal cancer patients are randomized to 2 different strategies. A standard strategy, TML-like, first-line doublet, FOLFOX-Bev, followed after progression by FOLFIRI-Bev, or an experimental strategy, upfront FOLFOXIRI-Bev, followed after progression by the reintroduction of the same agents. And the primary endpoint is a PFS2, the time from randomization until the second evidence of disease progression, in order to properly assess the efficacy of the whole first and second line strategy.
Okay. How was the management of adverse events in the experimental arm?
Actually, we confirm in this study that FOLFOXIRI plus Bev is associated with a higher incidence of some specific chemotherapy-related adverse events, especially in terms of diarrhea and neutropenia. However, the management of these adverse events is not different than what we are able to do in our daily clinical practice with doublets. I mean, there is a higher incidence but not a higher seriousness of diarrhea or neutropenia. And actually also the incidence of febrile neutropenia is around 7%. That is much below the threshold for the use of prophylactic GCSF.
So when it comes to the endpoints, they were met and everyone came away happy?
Yes, the study was positive. The primary endpoint, PFS2, was met, and actually patients in the experimental strategy derived a significant benefit when compared with those in the standard strategy. So also results in terms of first line, response rate and first PFS with FOLFOXIRI plus Bev are highly consistent with those already achieved in the previous TRIBE study, thus confirming the magnitude of benefit of the intensification of the upfront chemotherapy backbone. So I think that based on these results, the take-home message is that actually starting the therapeutic route of metastatic colorectal cancer patients with FOLFOXIRI plus Bev is able to provide a long-term benefit, and that the concern with regard to the superiority of the triplet when compared to the pre-planned sequential strategy of exposure to the same agents is a winning strategy. So upfront intensified regimen has a good impact on metastatic colorectal cancer patients' outcome.